I'm going to talk a little bit about the oral health strategies for the eating disorder patient. This protocol is very similar to the patients with acid reflux because basically what we're talking about is acid erosion. It's a very, very specific thing. But we're going to work with your primary care physician and your therapist in coordinating a treatment plan with our objective to minimize the oral consequences of purging. Treatment objective, primary focus on reducing acid regurgitation and the effects of that because it's substantial. The dental objectives are neutralization of acid attacks and preventive treatment of for the damaged surfaces. Initially, when a patient's under treatment and they're still not successfully controlling their syndrome, we may be talking about neutralization protocol after purging, using some type of a rinse, baking soda immediately after to neutralize the acid attack. So the diagnostic objectives, when we see increased acidic tooth erosion, we have to have this conversation. The first time I saw this was in my practice was a young patient, a male in his 20s, who had recently moved to California, to Hollywood, to be discovered or whatever. And it took me a minute or two to put two and two together. But this was something that he was doing to, address his weight issues. So these are salivary imbalances. The problems besides the tooth erosion can be tooth sensitivity, halitosis, which is bad breath, and actually inflammation of the mucosa, the lining of the mouth. Salivary diagnostics would play an important role here so that we can kind of see what kind of baseline, what kind of salivary challenges. Having the conversation about acid is really, really important in any of these challenges. Okay, so we need to know about pH and acidity. And we've got some handout material to educate about that. We'll go through the bacteria conversation with the video microscope, but the treatment objectives are mainly focused on salivary pH. Home care products, definitely heavy on pH neutralization, fluoride, remineralization, xylitol, antimicrobials, but we will add a local area delivery mouth tray in all cases here, okay? This is an LAD tray with a paste. This would be worn for 10 minutes morning and evening to mitigate some of the effects, okay? So we'll determine a recare interval with the dental hygienist, and I guess basically would be whether a patient is in recovery or, and going through an episode of actively purging as to where, so this recare might be kind of to be determined, and it could vary depending on what a patient, but that's why this treatment, like all others, is specialized, it's integrated, it needs to be worked with the other healthcare professionals with the specific dental objective of minimizing the damage to the dentition. The damage in this case is substantial. Acid erosion that affects all of the teeth can lead to the need of, one, having all of your teeth extracted, extremely traumatic, extremely expensive, or a full mouth reconstruction where all your teeth need to be capped because of the nature of the erosion where all the necks of the teeth are eaten away. This is not something that's treated with a filling. Okay, so the implications of this in both acid reflux and in eating disorders financially is astronomical. That's why we need to intervene as soon as we become knowledgeable of the problem and try to create an integrated treatment plan with the other healthcare professionals.